Right, so we start with a matter that has been of controversial nature for some time now, and it's got to do with health. Now, 15-year-old kidney failure patient Priscilla Asante died less than 48 hours after she spoke to Joy News and made a passionate plea for government through the National Health Insurance Scheme to absorb the cost of dialysis treatment. Now, her parents at the time could not afford the cost of the much-needed treatment, which left her bloated and eventually died. But several months on after her plea, her wish has come to fruition, as the National Health Insurance Scheme is set to begin a free 6-month dialysis program. Joy News Dialysis Crisis series brought the issue to the fore and tracked promises made by government and other stakeholders. The series culminated in a big conversation on the matter last year, with stories checking progress last month. We'll bring you details about that statement that came from the NHIS this morning. But first, here's Priscilla Asante's story detailing her struggles, and then eventually she died.
The humming sound of medical equipment here at the renal unit of the Cape Coast Teaching Hospital welcoming patients. It's a Tuesday morning and 15-year-old Priscilla Asante is being wheeled into the renal unit here.
The doctors told me I have to be on a machine, and I have to be on that machine either twice or thrice a week.
For now, she has to travel nearly 100 kilometers from Chifu Mampong with her mother to the Cape Coast Teaching Hospital every Tuesday and Thursday to have her dialysis session.
My mom and dad do not have money either. We have become miserable. I am appealing to the government to help me live through this. Otherwise, I may die.
Priscilla, a junior high school pupil, now carries a weight much heavier than her school bag. Her daily battle now is not with textbooks and homework, but with the relentless adversary, renal failure.
I want the government to support me so I can live to fulfill my dream of becoming a nurse.
The burden of her illness has not only taken a toll on her fragile body, but has shattered her world due to the family's precarious financial situation.
They said that could be 3.5.
They say every section is 350 cedis. And this in addition to getting blood and other medication.
Priscilla's mother, Ruth Ofori, has been a pillar of strength for her daughter and is determined to ensure her only daughter lives. With teary eyes, she shares the story of her family's headache, struggling to cope with the emotional and financial strain that comes with caring for her only daughter battling renal failure.
From the doctors, if I keep on missing this section, I may lose my daughter. And I need the help of the government.
Her voice quivers as she recounts the sleepless nights and endless hospital visits, each one a reminder of their uphill climb. But Priscilla is not alone in this fight. Thomas Vincent Khan has lived with kidney diseases for a decade.
The people who came and could not survive just a week or even a month. So for me to survive it all these 10 years, it's really been a tough one.
For Thomas, the thought of heading to the dialysis machine is not just physically draining, it's also a haunting financial specter. The towering cost of dialysis looms over him like a relentless shadow, casting doubt and despair. Thomas speaks of the silent tragedy he has witnessed over the years, a grim parade of 100 busloads of people who have lost their lives to kidney failure because they lack the financial means to access dialysis treatments.
Most of the time, it's not easy always chasing people or asking people for help, because it is very difficult to sustain For instance, if somebody gives you 1,000 to help you, you can't go to the person every day or every now and then to ask for the same help. And this is a disease that you always have to be coming to the hospital. Without that funding, you can't come for dialysis. And here is a case that it is a pay as you go. So it means that if you don't have money, you can't come for dialysis. And like I mentioned, there are people who have died because they cannot have the money to come for dialysis. And to tell you the truth, there are lots of the people we have lost, not because of the disease, but just the thought of finding money to come to the hospital. That alone has killed them. If there was any support for them, if they had the money, I'm sure they would have been here by now, and then perhaps be coming to dialysis just to sustain or manage the situation. But unfortunately, because there is no money to support them, we have lost all of them.
Each one, a story of unfulfilled dreams and shattered hopes, adds to the weight of despair that Thomas carries.
We wish that we'll have a strong funding to support our clients, those who are the vulnerable ones. Some are unable to pay even for a session of dialysis.
Kwesi Brown has worked in the renal unit of the Cape Coast Teaching Hospital for 20 years. Over the period, he's seen many families come to him, instructing him to take their relatives from the machine to go home and die, a situation that breaks his heart.
You won't believe it. There are some who even come in, and they come in, tell you that now we don't have money to come anymore, and so please take off the catheter for us to go home. Because they can't, they just don't know how to get the nurse, the idea is to go home and die. You understand? It's sad, but if we have a fund in place, then from that fund we can support. Sometimes people, transportation from their places to this place itself is also a challenge, in itself. Once the transport fares are going up, it becomes problematic for them.
It's a story of Priscilla, Thomas, and countless others here who bear the heavy burden of kidney diseases. It's a stark reminder that the battle against renal failure is not only fought in hospitals and clinics, but in the hearts and homes of individuals and families who continue to grapple with its physical, emotional, and financial toll. Richard Kwejo for Joy News.
Right, so Priscilla wanted to become a nurse. That dream did not materialize because she couldn't live to see that day. But one of her wishes was that government should intervene in the dialysis issues. Now, there's good news because the National Health Insurance Authority, they've taken some steps to make it more affordable, if you like, depending on how you look at it. It may not be 100% absorption, but there's some kind of a relief for those who are going through dialysis treatment. Joining us for more on this, we're going to get Kojoba for Ahenkra, is president of the Renal Dialysis Patients Ghana, and also Oswald Iswa Mensah, director of communication for the National Health Insurance Authority. But before we bring them in, let me update you on the position of the NHIS as far as this matter is concerned. So this was issued on June 1, that's Saturday, and it's a very straightforward statement. The government of Ghana, through the National Health Insurance Authority, in its 20th anniversary celebration, is pleased to announce significant enhancement to its health benefit coverage to include dialysis patients for a period of 6 months. And it's as follows. Vulnerable groups, that's patients aged below 18 and above, that's 60 and above. Patients aged under 18 and above 60 will receive all 8 free dialysis sessions per month under the National Health Insurance Scheme from June to December 2024, as indicated. So you have the breakdown there for you: June, July, September, August, September, October, November, all the way to December. And the NHIS is projecting that they will spend 2.3 million Ghana cedis. Now, the cost of dialysis for these categories, upon verification of the actual patients on the dialysis, is projected to 239,000 per month by the end of December 2024. The cumulative cost is estimated to be approximately 2.3 million Ghana cedis. This is some relief, if you like, even though some would have wished that it should be institutionalized on a permanent basis. But how are they receiving this? Let me bring in Kojo Bafo Ahenkra, President of Renal Dialysis Patients, and of course, Eswa Mensah, Director of Communication for the National Health Insurance Authority. Mr. Ahenkra, first to you. I mean, this has been long in coming. Finally, the implementation date is set. It started on the 1st of June. But, you know, not everybody stands to benefit. But at least it provides some relief for some of you.
Yeah. Thank you. Yeah, it does. At least it's not like 100%. At least even if it's one session, you appreciate to have getting the one session. Because if somebody tried to sponsor you or pay one session at dialysis for you, he has saved your life. So it's a welcoming news. We appreciate and we really thank them for whatever they've done for us. But like I said, that is not a solution to the whole thing. 8 sessions and then they are taking 2 for you. Yes, it's a milestone, but the point is, how do we survive with the 6 sections there? So yes, we really appreciate them. We thank them, and then let's see the way forward from there.
All right. We'll come back to deal with the nitty-gritties of the announcement. Let me also bring in Oswald Mensah, Director of Communication for the NHIS. Oswald, good afternoon. And I mean, perhaps for those who are in dire need of these services, they will say congratulations and for a good work done. So this has already started, right?
Good afternoon. I hope you can hear me.
I can hear you loud and clear.
Thank you. Thank you for having us. Yes, the announcement was made public over the weekend on the 1st of June. And I believe that from this month going forward, once claims are submitted with regards to the breakdown that has been discussed, NHI will certainly pay for these claims. So in effect, we can say that the policy has started off.
Right. So for 18 years and above 60, that is the NHI taking care of the entire, dialysis treatment.
And the announcement, as it says, really will cater for all categories of patients. My brother, Mr. Dankwa, did say that, of course, let me go back and state that
right.
The money that was approved for Parliament did say that there was a seed money of 2 million cedis, and the NHI should take care of the very vulnerable within the patient spectrum. Of course, I have engaged a lot of the patients, and everybody would rightly tell you that they are also needy and need to be covered. But in the strictest terms, and of course, we've had a series of meetings with other stakeholders, including Mr. Dankwa himself, and we kind of agreed at this point in time that it is an ongoing process. This is only the beginning of perhaps what will be a more sustainable way of financing dialysis treatment in Ghana. It's the first time that the scheme is doing this. So at this point, we're looking at how best we can save the situation for the very, very vulnerable. And when we say vulnerable, we're looking at children who fall under the age of 18 years and those that are 60 years and above. So for that category, we're happy to say that NHIS will take on board the full cost of the dialysis sessions. And I believe that's about 8 sessions in a month.
Right.
And it doesn't stop there. We're also going to take care of patients who are also within the active bracket, which I would want to refer to as 18 years to 59. Those who are outside of Konebu, and in particular, we're talking about Konfanoche, Cape Coast, Ifea Kwanta, Old Teaching Hospital, Tamale Teaching Hospital. For those who are receiving treatment in these centers, in as much as we also want to assist, what we're saying that at this point in time, we'll be only able to pay for 2 sessions.
Right.
Full sessions at these hospitals. And for those in this active bracket, and when I say active, obviously, it doesn't also mean that all patients are unable to perhaps have any economic life. So these brackets perhaps may have some of economic support. So for those who are seeking treatment in college, what we're saying is that we'll pay for 50% of 2 sessions. And by the breakdown that we had, each session was supposed to cost about 491. So NHI will pay for 2 sessions of the dialysis treatment that they have, which will amount to about 1 million. Ghana cedis. Again, I think it will be instructive to state that NHIA, as I said earlier on, only received an amount of about 2 million cedis as seed money for financing this particular disease condition.
Right.
However, we've gone a step further to also add on 2.4 million Ghana cedis to make it a total of 4.4. And that 2.4 is coming from our corporate social responsibility fund, which we are looking to use to, as it were, shore up what the difference will be. And another question that people are asking is how sustainable this is. Mr. Danko himself has asked that question.
Exactly.
I just want to say that, you know, a journey of 1,000 miles begins with one step. So today, let's be happy. Let's celebrate this win, and let's look forward. Let's keep engaging. Let's see what may come out down the line to make sure that going forward past December, the story will be different and we'll have better outcomes. Right,
Mr. Mensah, so I just want to come in and ask, so do we know the exact number of people we are targeting? Because I know that diagnosis is happening almost virtually every day. New entrants may be added onto the list. Have you looked at the numbers?
Yeah, currently as we speak, we've engaged with stakeholders and we have a number of about 531 patients that are receiving dialysis across the country. And these are, of course, those that have presented themselves for treatment. So this is a number we're working with for now. The children or the vulnerable category, we classify them to about 84 in number. Okay, and then those that are receiving treatment outside of Kolebu between the ages of 18 and 59 are about 147. And those that are seeking treatment from Kolebu within that same age bracket is about 300. So when you add all of that together, it's about 531 patients is what we're looking at this point in time.
And my understanding is that more of them are at the Kolebu Teaching Hospital.
I want to believe so, yes, because of the facilities, yes. I think that Kolebu in itself is a referral center, so we have about 300 odd number seeking treatment in Kolebu.
I'll come back to look at the long-term solutions from the NHIA point of view. But Mr. Henkra, this is obviously good news. I mean, you've been fighting for this for some time now. Even for those who don't fall within the category of full absorption, it is some kind of a relief. Don't you agree?
Oh, yes. That is why I stated earlier on. Yes, it is. It's some form of relief because, like I said, if you are doing 8 sessions, and then you've taken 2 out of it or you left it, it's some form of relief. So, yeah, it's a step in the right direction. We really appreciate what they've done. But like I said, we are looking for a long-term solution. I was part of the committee that set up to look at all those things. So I know everything that, the things that went into it for all these things. So it's a step in the right direction. We are not saying anything bad about it. We really appreciate it. It's very good. Like we are hoping come December, maybe something more perspective will come out. So we are not debunking, we are not saying anything, but we are just thanking them for what they've done for us so far.
How many of your members are below 60 and above 18 that will have to just, will have to just settle with the 2 sessions that the NHIA wants to take care of?
Can you hear me?
Yes, I can hear you.
Okay, good. The question you asked, how many, that the numbers there, it's not that significant. The point is between 0 to 18. Kolebu outpatient, I can count about 3. If my memory serves me right, I can count about 3. The aged to, they are normally about 10 or 12. 10 or 12, that is above 60. So the numbers there are not that significant there, but this is what I can talk of. But day in, day out, people are coming. I mean, day in, day out, people are coming. So you wouldn't know when it will be increased or to come down.
So currently, as you speak, how much are you paying? With the approval by Parliament of the fees and charges?
Yes, as at this morning, when I did mine, I paid 491.
491 Ghana cedis.
Yes.
And this is the new fees approved by Parliament.
So we hear.
So when do you expect to benefit from this NHIA intervention?
Oh, they are saying it takes effect from this month. So if I have 8 sessions and then throughout this month, and then I'm giving 2 free sessions. Probably my next session is on Friday. So when I go, I'll just alert them that I have 2 free sessions. So maybe today I don't have money, so I'm using one of my free to dialyze. Because like my brother just said, it's taking effect from June.
Right.
Today is 3rd June. So anytime I want to use the free within the month, it's up to me.
I also want to understand this. I mean, the last time you visited us in our studio, there's discussion about the other contributors to the center, that their contribution is expected to make life even easy for you. There's the First Star Group and the rest. Some monetary contributions that they've made. And you wanted to even understand how come you are paying when there appears to be some kind of intervention and yet you are paying from your pocket. I don't know whether you've gotten clarity on this particular matter.
Oh yes, it's still like you just said. So we still need people coming to support us. We will still need them, because the other day I was telling you that the point is, what they are doing is dialysis. They are paying for the dialysis. Now there are other medications that we buy. There are other labs that we do. There are other injections that we take. All is seriously cost of money. So those people that who comes in to support us. Still, we are still in touch with Polibu to find out how far they've gone with it. But still, we are still appealing to the public to come out and support us. I mean, who knows tomorrow? I keep saying, when you go for a session, every week you're supposed to take an injection, the erythropoietin. You're supposed to take, and that one is almost about 300. Your BP medication has not come, your iron has not come. So we still appeal to the general public to come and support us. Whilst the government is doing, the National Health Insurance is doing this, we appeal to them to come. That one that you talk, we are still in talk with Polibu to find out where things have gotten to.
Right. Let me bring in Mr. Mensah. Mr. Mensah, so as we look forward to the future, is it possible that the NHIS may in the future fully absorb, dialysis treatments?
Hi. I think it was a bit premature for me to try and suggest what could happen, but I know that definitely the conversation has started. Right. It's not ended. The gestures have been made. We've all seen where we are today. We can only pray that all categories, maybe someday, would see some full funding from NHIS. But saying this, I think what is also lost on us as a people that we have to begin to start talking about is how we can support the population to ensure that disease conditions are detected early enough. And we don't wait for it to get to chronic cases before we try and spend so much money. I believe that you've probably been following NHIS to the extent that we're trying to have a paradigm shift where our payer services doesn't just end up with NHIS paying for claims of, huge bills month on month or year on year. What we should begin to start looking at is how we can benefit from or encourage, our population to empower themselves to begin to take promotive and preventive checks. These things, perhaps, the ordinary blood pressure check, the blood sugar checks, body mass index, these things have the ability to detect disease conditions, early enough for us to seek intervention. These are things, that consciousness that we must begin to start discussing as a country and not just fixate our minds on payment for claims. We have to have a paradigm shift, a new way of thinking for us as a country, to begin to take wellness and promotive health checks seriously.
And that brings me to the concern about the health of the scheme itself. I know that you've been following the news. Last week, the minority went so hard on the NHIS, saying that the scheme is being run down. You are cash-strapped, to the extent that they made a point that the amount of money left in the scheme account was, around 1 million Ghana cedis. And I know that, there's been discussion about increasing the premium and all that. Is the scheme very healthy?
Thank you. I don't know about NHIS not having money in accounts, but what I can tell you is that NHIS pays on average about 170 to 200 million Ghana cedis a month for claims. I haven't seen a situation where on a monthly basis, payments have not gone. But the call for NHIS sustainability is in the right direction. All the parties, all well-meaning Ghanaians support the scheme. And I believe that anybody who calls for NHI to have extra funding, it's in the right direction, because NHI itself, as you know, today we're talking about dialysis treatment. We have mental health knocking on our door. We have prostate cancer knocking on our door. We have so many different disease conditions that are knocking on the doors of NHI to absorb as part of payments for the scheme. So if there's a situation which can make NHI more liquid, more robust, more responsive to the needs of our population, it's a welcome conversation. And I'm sure that it's something that will be carrying on well into the future to see how the scheme can be very resilient to take on any new disease conditions that may come upstream.
Is an increase in premium the only way out?
Increase in premium may not be the only way out. Increase in premium, as a matter of fact, if you look at our revenue streams, you'd realize that the premiums are perhaps about only 4 or 5% of our inflows. So premiums really are not the way to look at sustainability. We have to continue to inject efficiency in our operations. We have to look at using technology to drive the scheme. We have to make informed decisions based on data, and so on and so forth. These are the things that will help. But of course, there are other external issues that once they are taken care of, the scheme would have enough funding. Others have called for sin taxes. Some have called for expansion of our revenue streams, and so on and so forth. So we are open for funding to make the scheme more resilient.
So finally, before I let you go, so as it relates to the treatment of the kidney patients, the arrangement is that they go to the health facility will present their claims, and then you pay them. At least for this arrangement, that is expected to last for the next 6 months.
Yes, by the architecture of the health space, what we do is the facilities that are credentialed to see NHIS patients will go ahead and see the patients. And at the end of the month, they will send the claims to NHI, or vet, and then we'll pay. I don't want to believe anything will change in that regard. So once patients are seen within any particular month, it's our patient that will receive the claims documentation, and we'll subject that to scrutiny before payments will be made.
And there's a possibility that this 6 months window of opportunity can be reviewed along the line. That is if funds are available.
We'll leave that for government to decide.
All right. Mr. Mensah, thank you very much. Communication Director with the National Health Insurance Authority. Let me bring in Mr. Henkra as we wrap up on this conversation. So you've heard everything. It will be Kolebu or any health facility responsibility to push the claims to NHI, and then they will pay. What will be your final thoughts as we wrap up on this discussion, Mr. Henkra? Yes, Mr. Henkra, if you can unmute for me so we can hear you.
Yeah, I can hear you now.
Yes, please go on. So I was asking about your final thoughts on this matter. NHI say they are ready. All they will require is that the health facility present the claims, and then they will pay.
Okay, then we are with them. Like you just said, if they are ready, they should present their claim. Then we beg them. But now the information that I'm getting, that some of the patients are saying that the hospitals are saying that they are not aware. They've not been authorized to do that. So if they are ready, we are good to go. Then they should alert the hospitals that the patients can now come and dialyze.
Are you able to tell us which particular hospital is refusing to attend to them?
Not that he's refusing to attend to them. The point is that they are saying that they have not been notified to start doing that. And now the news is outside. So we are begging the National Health Insurance to alert the hospital, Ministry of Health to alert the hospital that the patient that they have, Kolebu, for instance, where I dialyze, I have 2 free dialysis sessions of this month. So maybe when I come and I don't have money and I say I want to use one of my free, they should understand. Or they should let them know it has taken effect. So when they are coming, they should allow them to do it. All that I'm saying. But Kolebu this morning, some people paid.
All right. So the concern is that they got the information that Kolebu says that they are yet to be told officially.
Yes, that is it.
All right. And I'm guessing that as leader of this association, you will take it up and iron out whatever issues that exist so that people can enjoy this for free, as has been promised by the NHI.
Oh, sure. It just came out. And unfortunately, I lost my mother, so I'm a bit so from tomorrow, I'll make sure that thing is ironed out. Then we'll take it from there.
Mr. Arenkwa, my condolences on your loss, and I want to thank you very much for joining us this afternoon on the pause as we discuss this steps taken by the National Health Insurance Authority on the treatments of dialysis. Now, it started on June 1 and it's ongoing. So the NHIS say that they are paying for the cost of treatment. There's a category of people who have it for free. That is below 18 and above 60. And they will enjoy the session, the 8 sessions for free. NHIS taking care of them. But for any other category of people above 18 and below age 60, NHIS program is that they will take care of 2 out of the 8 dialysis sessions for every kidney patient. And they are estimating that this will cost them over 2 million Ghana cedis. And it's going to last from now till the end of December. If along the way government see it fit to review it, then the discussion will have to be had on the way forward for this particular matter. This is a pause here on Joy News with me, Elton Brobe. Now, away